Hey there guys, Alex from Mental Health Thinking here. Today this will be the first part of my series discussing different kinds of therapy. Now I've got Chris Martin here. He's a psychologist that works down in palliative care, and he focuses on acceptance and commitment therapy, or ACT, in his practice. So I wanted to talk to him and get a bit of an insight that you as a psychologist deciding what training you might do, or you as any person deciding what kind of therapist you might want to see, could take on and give you more of an idea about it. Okay Chris, well the first question that I had is ACT compared with other therapies. What would you say characterises it?
What characterises ACT is it takes a different stance than other therapies might do. ACT looks at not judging or not getting caught up or tangled up with thoughts or emotions or beliefs that you might have. It talks about and aims to create room for them and accept them for what they are and continue to live a meaningful life, even though those particular thoughts, emotions, beliefs might be present. They don't have to get in the way with someone living meaningfully. A lot of our Western culture is about things needing to be removed before we can do something. It's something that we get trained very young from, as we're a child, we get taught that if you've got X, you need to get rid of X before you can do Y. And that works fine in the sort of external, practical world. Maybe there are certain things that if they were no longer there, it would be more helpful and you'd be able to achieve what you wanted to do. The problem is that that same ideal doesn't quite apply to the internal world. It doesn't apply to our thoughts and our emotions and our beliefs because it's harder to get rid of those things. And it's still possible to live despite what's floating around in our mind and in our bodies.
Okay, so the understanding of really making the best of what you have.
It's the approach of accepting what you do have. And accepting doesn't mean that you agree with it. It doesn't mean that you like it. But it's the acknowledgement that it is there, but it doesn't have to get in the way.
Okay, so if somebody was making a decision for themselves as to whether they should look for a psychologist who can perform ACT or who uses ACT as a therapy base or not, what types of things do you think that they should or would consider?
Probably the question needs to be directed back upon themselves as a person rather than towards the therapist. So I think the individual needs to have a look at what they've tried previously to help fix whatever they're struggling with. If they're noticing a pattern that no matter what they try, it doesn't seem to be able to help them to live the type of meaningful life that they want to live. It doesn't, no matter what they try, it doesn't get rid of the problem. Then maybe ACT is very applicable for them. Because ACT doesn't look to get rid of the problem. The problem is not the issue, really, from an ACT point of view. The issue is how we manage what we're experiencing internally. That's really the core aspect of ACT. How do we respond to everything that it means to be human? Because all of our thoughts and our emotions and bodily sensations, that's a part of being human. Let's not aim to get rid of them because the vast majority of the time that'll be pretty hard. Let's aim to embrace being human and work with them effectively to live the life that we want to live.
Okay. Yeah, and that's a component of ACT, isn't it? It's helping people to realise that all the things they've tried so far have the one thing in common, that they're trying to get rid of their problems. And it hasn't been working. So it's creating a situation where they realise that maybe that's not the most effective way, and here's something else to try.
Yeah, and I think something, just to clarify there, because it has come up in other discussions about ACT, maybe more so in the earlier days. There was a scenario that was proposed to the developers of ACT, creators of ACT, being Stephen Hayes and Kelly Wilson and Kirk Strossel, are you suggesting then that if someone's in an abusive relationship, they should accept that and make room for it and continue to live in that scenario? And that's not what ACT is about. ACT isn't about keeping you in a situation that is dangerous. That's an external thing. If we can do something practically about an external thing and we can leave that because it's harmful, then we do that because that's going to help provide a meaningful life. But ACT is focusing on the internals, the things that we can't leave, that we can't run away from, because they're always inside.
Yeah, so it's making that distinction. And it's not just thoughts, it's also some emotions that keep on coming up, or say if we have chronic pain that just seems to keep on remaining there. Those sorts of things are also components of what might not be able to be gotten rid of.
That's right. Thoughts, emotions, sensations in our body, such chronic pain, memories, anything that's internal.
Could you give an example of a time that you've used ACT with a client and what the problem was and how you helped them through it?
There was a lady that presented to me for the first appointment and was very anxious about being anxious in public. And as she was describing this struggle that she was having with this anxiety, and anxiety was starting to overwhelm her in the room as we were sitting there together. And in that moment, I made the decision to just put aside the assessment process and become really present with her. So being present in the moment is one component of ACT. So we were present. We took that time to become aware of what she was experiencing, to notice all the components that were arising as her anxiety was developing and going through the process that she faced on most days, and learning how to sit with that. And what that experience led to for her, it was over about a 10-minute period. What that led to was her starting to develop a new perspective on her anxiety. And it was a perspective of, well, hang on, that wasn't actually as scary as I thought it was. I can actually sit with this anxiety. It is not as painful and something as to be feared. And so for that individual, that was a very sort of profound, shall we say, sort of light bulb moment.
Yeah.
And I only actually saw her one time after that, and as a follow-up, and she had really let go of the struggles that she was having with that anxiety and started to do the things that she wanted to do, such as going out on events with her partner and meeting up with friends, things that she had pulled back from because of the fear of that anxiety.
Right, and that does often happen with ACT, doesn't it? Where even though the goal isn't to tackle head on whatever the problem is, the emotions or whatever keeps on coming up, by accepting that they're there and not continuing to do what you were doing, that was trying to push them away and actually keeping them there, they actually do tend to decrease. Does that seem like an accurate statement to you?
It's definitely not uncommon. It's not guaranteed. I guess what's really important to consider is that even though what is being experienced, such as anxiety, even though it might not actually decrease, because the view of it has changed, because the perspective has changed, it's no longer seen as threatening as what it was. So even though if we connected up electrodes to the body, measured the heart rate, etc., and all the figures would be exactly the same in terms of how the body was functioning physiologically, once a person can learn to be with that anxiety or whatever it might be, the threat of it is not as much, and so it is feared less and has less handle over us. There's a common metaphor used within ACT, and that's, very briefly, it's about viewing your life at that present time with the struggles that you might be facing as being in a battlefield. And when you're in that battlefield, you very much think that the only way out is to end the battle. You need the battle to be won. However, might an alternative be to step out of the battle and to view the battle from a nearby neighbouring hill? The battle is still happening, but you're no longer in the midst of it. The need to win it is no longer as prominent. The battle can go on and you can do what you need to do.
Yeah, it's certainly an interesting frame of mind that comes from it. So for those who are thinking at this point that ACT sounds like it could be a good idea for them, what are some other factors to consider there for
them? I think maybe firstly to those that are watching this video and maybe a bit uncertain, preferring to go down the path of I just want to get rid of the pain that I'm experiencing, whatever pain that might be, then I encourage those people to keep trying to do that. That's fine. If you want to go to other practitioners that use other forms of therapies, or go to other doctors if it's a medical type thing like chronic pain as just one example, or irritable bowel syndrome, go see if they can provide what you're looking for. So if as a result of going to those other practitioners, other doctors, trying those other ways, the results not being achieved, consider ACT again at that point.
Okay, so it's not too late really.
It's not too late.
You can always decide that it's the right time for you.
Yeah, and choosing ACT is a brave thing to do, really. I mean, as I mentioned previously, we're not trained in this kind of approach from when we're a young child. We're trained to get rid of things. So it's brave to do the opposite, to allow room for these things that are painful to us. I guess we could view these things a little bit like a bully. We could fight the bully and give the bully what the bully wants, and the bully just grows bigger and bigger. Or we could be kind to the bully. The bully might get frustrated at that initially and might ramp up his efforts, but eventually, because the bully's not getting what he wants, the bully's gonna calm down, go bother someone else. So it's a similar thing. Let's not run away from the things that are painful to us. Let's embrace them. Let's be kind. Let's be compassionate to ourselves. Recognize that all of those things are a part of being human. We don't need to fight them. We need to accept them and commit to living a life that we want to live, even though they might still be there.
Okay, well I really appreciate you doing this interview today. I hope that it's been helpful for people who are thinking about whether ACT is the right thing for them. And I think that's a good place to end it on.
Thank you.
Thanks a lot, Chris.